Hey y'all, welcome to Chief Complaint, Tacky
and Caffeinated.
I'm Jess.
And I'm Britt.
We're two nurse practitioners, moms, wives, and longtime friends who met in nursing school, and somehow we've managed to juggle evolving healthcare, careers, and our home lives.
This is where we talk about the things that don't fit into a 15-minute visit: healthcare, beauty, motherhood, marriage, business, burnout, and whatever else life throws at us.
Chew in peace,
real life,
and fully caffeinated.
Hey y'all.
Hey y'all. Today we're going to talk about aesthetics, and this is episode 7 of the podcast already. So we're just going to kind of get into it and talk about Botox and filler. Some of you may know about it, may have had it. Me and Jess have both had our share of it, plenty of it.
Yes.
So we're going to kind of go over things that we know about it, what we've seen, and kind of give you some tips if you're thinking about going to get yours. So Botox, there's so many different types, but the word Botox, when you say that, people know what it is.
Oh yeah.
Yeah, like everything's Botox, even if it's Dysport or Jeuveau or Daxxify. My favorite right now is Lativo. It's Korean Botox, but it works within 24, 48 hours. It lasts longer than Botox. What have you used, Jess?
I haven't had that one yet, but I'm going to come back and probably Monday
Do that.
let you hit me up around the eyes. I've had Xeomin and I think that's all I've used. The Xeomin.
Xeomin. That was my favorite before Lativo, but because of cost too, and effectiveness. I started noticing the more that I was injecting patients, Botox was not working as well.
Yeah.
And so.
And it's more expensive.
It is way more expensive.
The brand Botox.
The brand
is more expensive.
Yes. And now that there's competitors, they're kind of like bumped off the island. But people were gaining a tolerance. Their body was creating antibodies.
Really?
To that time. Because there's different types of botulism. And that one specifically, and I said there has to be some kind of resistance, because people would come in and they were not lasting 3 months. Didn't matter how heavy I loaded them. It wasn't that. It was their body has been having it for so long, consistently every 3 months. Now we're doing every 2 months, and it's like something's wrong.
Your body has recognized it and knows how to break it down now.
Yeah.
Because so the patient's considered something foreign in the body, right?
Yeah.
So it's probably
trying to be protective, and
our body trying to be protective and break it down, get it out there. Yeah.
Yeah. So botulism, that's what's in all of these. Neurotoxins is what they're called. But pretty much the toxin gets into the muscles and it deactivates the muscle fibers so that there's no contraction. So if there's no contraction of the muscles, there's no crinkling of the skin. And so that's kind of the idea behind Botox. Brain Botox, you can get it injected in like 14 days it'll work. But there's newer ones like Lativo, Daxxify, Jeuveau. They work a lot sooner. Dysport works sooner. Dysport has a different reconstitution than all of them. So
it's less units, right?
More units.
Oh, it's more units.
It's more concentrated. Right. And it has it has a bigger spread.
Oh, because it's more volume of fluid, so it spreads
I've never really done that. If it was in a place that I worked at, we used it up and I never used it again. But there was too much to think about between the conversions, and I'm like, no.
More room for error.
More room for error and a bigger spread. Lativo has such a small spread. And so you have to like make sure you're getting into the belly of the muscle. Otherwise, they'll still have movement. Like you've got to put it directly where it's supposed to go, because it's not going to spread very much. So that's kind of the difference that I've noticed with Lativo. And then Xeomin, I switched a lot of my Botox resistant patients to Xeomin, and we never had that issue again with the resistance. So does everyone need Botox? No, to each their own. I mean, if it bothers you, there's preventative and there's reactive. So preventative is probably when you start in your early 20s. You know, you're out in the sun, you're tanning, all these things, and you want to prevent. You're very expressionative. You can already see static lines forming. Static lines are like when you're resting and you can still see the lines. Those are static lines. And so if you start seeing that, then yeah, you could benefit from going ahead and starting it so that you're not wrinkly like a Shar-Pei by the time that you're doing something. And then there's reactive, which is, I've had those patients come in and they are just leather face.
Yeah.
And don't wear sunscreen or nothing. It's like the elasticity's gone. Like I can't really fix it at that point. It's going to take laser, facelift, something else rather than tox.
Yeah. And smokers, vapors, straw drinkers, you can still get what's called smoker's lines from that pursed lip all the time.
Yeah. And you break down your filler a lot quicker. People that smoke or straw drinkers, but mainly smokers, instead of the 12 to 18 months, you tell them you're going to be about 6 to 9.
Yeah.
Probably.
And then it goes for vaping as well.
Yeah. Mm-hmm. Yeah.
And it's not necessarily, so there's the misconception that the smoker's lines is from just smoking cigarettes, but it's not. It's that pursed lip.
Yep. And crunching that skin around because it's a circular muscle. So people will have lines all the way around their lips. And at that point, we could put filler in, but the lines are going to remain. Something has to happen mechanically to bring some new skin on board. So, and then there's a lot of people that have this stigma about Botox that, that you look frozen, look plastic. So why do people look like that? Why do you think?
Okay, several things. So my immediate thought is, like the botch people the botch celebrities from back in the day. So I think back before there were regulations, people were kind of overdoing it. I don't know if medication has changed or if it was the injectors, or if people finally caught on to the risks or something with it, or doing enough. I'm trying to think, what is that? There's some show, I think it was was it The Longest Yard? Where those people were had a lot of surgeries or fillers and stuff. And they were talking about their Botox. That's the first time I remember seeing about Botox for a long time.
Black chicks? I think they talk about it in there too. Well, I don't know. I can't remember, but I know they talk about it in there too. With the Wayans brothers.
Yeah.
But yeah,
but so my first hearing that I remember hearing anything about Botox, that was the first picture I had of what Botox is, and I was like, oh, never getting that.
And people call Botox everything. Filler is Botox.
Yeah.
They're like, I want some Botox, but that's not what they're saying. They want fuller lips, but everything's Botox to the average Joe. But yeah, it's like overloading the patient, the injector not knowing when to tell the patient that's enough, or injectors are a lot of the time motivated by commission and bonus. And so ethically, it can be wrong, completely wrong. And that's, when you mix money and bonuses and commission with medical, you start then dealing with some unethical issues or unmoral things that people will do for money. And so they'll load someone up. Hey, you got $1,000? Yep. There's 100 units of Botox. Where do you want it?
Right. The more units I give you, the more money I make. So let's find some places to put this.
Yep. And they know they're going to look crazy. They don't care. They're like, oh, they want it. They got the money.
You asked for it.
Right. Yeah.
I just did what you asked for.
And so that leads into, there's a lot of legality with Botox and filler. I feel like that is a very high risk thing to do. And even when I'm looking at malpractice insurance, putting that on there or not putting on there is a big money difference. Like the amount goes up as soon as you do an aesthetics. And then some medical directors won't be your medical director if you're going to do it because they don't want the liability. So there is a lot, because you're messing with someone's face. Like, you could really mess someone up permanently, and then everyone's sue hungry or whatever you call it, or they just want to sue medical professionals all the time. Like, that's something scary. But being frozen is just too much. Too much. And some people like it that way. I'd much rather a patient tell me straight up, like, that's what I want. Okay,
Yeah.
we can do that. But not by an accident. It needs to be intentional.
And not not overkill either. Like,
yeah, you should have some movement.
If you, well, again, like if you want to be frozen, you still don't need 100 units.
Right.
You know what I mean? Like we can still achieve the frozen look without overdoing it.
Yeah.
Because it is still a toxin that you're injecting into your face. And although it's rare, like you can still have the risk of getting botulism or a central nervous system.
Putting it too much in the wrong place.
So there are still risks with it. And so you want to not overdo it.
Yeah. Weigh that over 3 months of no
You
wrinkles.
want a frozen look. We're not going to do frozen look today. We're going to start with a little bit here, and then you're going to come back and see me in 2 weeks. Let's see how you tolerated.
Right.
And then we'll see where we need to add more.
Exactly.
To get you that frozen look.
That's the way it should be. That's the way it should be. But patients end up talking you into it or whatever. Different places you can get Botox. There's so many different places on your body that you can get it. Insurance will cover it for some patients for migraine headaches, and you can go to neurologists and they'll inject all in your bed, and it helps with migraines.
Never are you letting anybody that's not a medical I'm not doing Botox injections for a patient for migraines.
Yeah.
Like, and I'm a nurse practitioner.
Yeah. I have my limit with that. Yeah.
So definitely if you're going to somebody that is not a medical professional, which we'll touch on that in a minute.
Yeah.
Never let them do Botox or anything other than cosmetic.
Because then how are you going to turn around and sue or claim, medical legality issues when you consented to that? If they had you sign the right stuff, then you consented to that. And you didn't do your research to see, is that a medical professional? Do they know anatomy? Do they know what this medication can do? And then what happens if things go bad? Do they know what to do? So with migraines, usually I'll do like the back of the neck, and like maybe a little bit up into the scalp here, but I don't do in here at all.
Yeah.
I don't do that. No. Because it takes so many units to do.
Right. And what you're injecting for here is tension, headache.
Tension.
What a neurologist is going to be injecting for, I don't even know. Would it be more like?
I think it's migraine and tension. But
is it still tension migraine?
I think so. Because, you can get them from tight muscles here, so then they inject in here. And then back in here, around the ear.
But up in the occipital region, or the parietal region, what are they injecting for there?
And, the average Joe can't afford that much. Like, especially the cost of it. Like, that's why insurance covers it, because it's a medical need. And then muscular dystrophy. In the past, when I took care of little pediatric patients at home, they would go and get, Botox in their limbs so they could.
For contractures. Yeah.
Yeah.
So at Truman, we did that a lot too.
Oh, yeah.
We would take patients and they would get injections of Botox for their contractures.
So those are good reasons that people actually really do need them. You can put tox in the armpits. It'll stop the sweating for 3 to 4 months. I have a few patients that do it because they sweat profusely from their face. So we do like the forehead, and they don't have that sweat running down their face. Hands. Some people have sweaty hands, and they'll do hands, platysmal bands.
Oh yeah.
But you need to know what you're doing around here.
Yeah. Veins and arteries and
your airway.
Yeah, airway.
So there's muscles that, create wrinkles here. It's called the Nefertiti lift. But you pull these bands out and you just inject. But those are advanced injectors. Like, this is not something you should go look up on YouTube, or injector look up on YouTube and then inject you. Like, no, it's not smart. So you're just asking for problems. So I think that's all the places mainly. They'll use it with, some urologists will use it for something to do with the bladder. Overactive, maybe.
Over.
Oh, are you making sounds?
Are you talking?
Our co-host wants to chime in.
Yes.
Mm-hmm. Tell them, don't do it. Don't do it. All right, next is filler. Filler adds volume to the face. People would want filler because there's loss of fat in the face. I wouldn't use filler in the forehead. It's too thin of an area. It's not vascular enough where if you have something go wrong that you can get good circulation there. So I don't do filler in the forehead. And if someone does, you need to be cautious about that. Because you can also cause blindness too. Filler, where all can filler go?
Aging women. Oh, where all can you put it? Yeah. Cheeks, lips, chin. Those are the main. Some people will do nose. The bridge.
Temple.
Tear troughs.
So
tear troughs and nasolabial, those are going to be more cautious areas, more high risk areas to have filler placed that you would definitely want to make sure that a professional is doing it.
Yes. And not everyone's a candidate. When we say nasolabial folds, we're talking about like right here. Well, this is only a symptom from a problem. You've lost volume up here.
Yeah.
So if we could add this back, we can fix the lower face. So you got to be an experienced injector to know that, because if you go into just average Joe, they're going to go straight for here. Then you got this flat look right here, you know? And it's like, that wasn't the problem to begin with. It was up in here. And so, you just need to.
You can do some in the jaw. I haven't.
Jawline, nose. I'm trying to think, is there anywhere? I mainly do it in the face. I have done it in the hands. And I would use Voluma because it's a large filler, and like women that have just real crepey hands and they're losing volume, like we'll tin it up and inject and then massage or have them sit on it. That's the only other place I could think of that's outside the face that I would do.
I didn't even know about these things. I'm learning.
There's so many different things. And Jess is right about this area. The lips and the nasolabial folds are very high risk areas for an occlusion. And I've never had an occlusion, but I have stuck needles into this area down to the bone and aspirated and got blood back. Yeah. Absolutely, I have. And scared me shitless. Because had I pushed that syringe, it would have been in the artery, and then a whole nother cascade of things happens, and you need to know what to do. So even experienced injectors, it's a luck of a draw. Yes, you need to know your anatomy, but everyone's anatomy is different. And going down to the bone is your safest place, because you're then down on periosteum and you know that you've down past the arteries and stuff. But and so your story about that?
Whenever I went to get my certification to do Botox and filler as a nurse practitioner, I went to get my certification. And while we're there, they need practice models, you know. So I love me some lip filler. So I'll be a model. So the girl that practiced on this portion of my lip, when she did the injection, it hurt. I was like, something's not right. And I've had filler before, so I know it's painful, but like this was different. And I pulled back. I was like, something's not right. And they're like, oh, it's fine. She continued to inject the filler. And I was like, finally I told them, I was like, that's enough. I don't want any more, you know, like, and so they went on and that class was over. The girl got her certification. We broke out for lunch. And while I'm at lunch, I'm looking in the mirror. I'm like, this doesn't feel right. Like something's wrong. I keep looking and I have a white spot on my lip. And I went back for the second portion of the advanced techniques. That's where we were doing the cheek and the chin filler. And so I went back for that certification part, and thank goodness I did, because my lip was just continuing to get white. Just this half of my lip, my bottom lip was white.
Which means what?
Occlusion.
Mm-hmm.
Yeah. And so I told one of the trainers, I was like, hey, this isn't feeling right. And so she was like, okay, we'll keep an eye on it. She was looking, and throughout the rest of the course, finally one of the trainers was like, hey, let me look at you again. And she looked, she was like, I don't feel good about this. She was like, I want to dissolve it. And so I had to have it dissolved. Had we not dissolved it then, I went home, which is what happens to most people that get a vascular occlusion. It starts off, it's not always just obvious right then and there that there's a vascular occlusion. That area has to go without blood flow for a little certain amount of time where you start to see the symptoms, you know? And so
that's why you see the white.
Yeah, the white is...
There's no circulation.
There's no blood flow there anymore. Like, it's occluded with filler. Like, you've...
it's a time thing.
Yeah. And so had I went home, went to bed, I probably would have woke up with my whole face necrotic.
Yeah.
You know?
Yeah. It's scary.
It is. There are serious complications that can come from that.
Yep. There are. But with Botox and filler, Botox more so like drop eyelids and stuff, but with filler, you're dealing with deeper structures. And that's when you start getting into legality problems, because you could really mess someone up where they need to go have plastic surgery done or something, and then that's a big problem. So these people that think they're injectors probably do not have malpractice insurance. So good luck.
Well, the other part for that too is like that girl that did the occlusion,
she's out there.
She got her certification and went on and left. You know, she didn't come back for the next part. So she is out there injecting people wrong, probably. You know,
because if you, her technique has to be wrong, and that's not always the case. Even good injectors can have inclusions.
Yeah, that's not always the case, but like
it would. But
she doesn't know the things to look for,
right?
You know,
she didn't get to experience that. Yeah. So, I heard of another patient that went and got filler from somebody's house, and she was a young person that got the filler. She didn't know any better. She didn't ask if they were a medical professional. She just got filler and then started losing her vision out of one side of the eye. So pretty much they created a stroke.
Where were they injecting it?
I don't know if they were doing, it had to have been this. I think it was lips or nasolabial.
Or a tear trough.
Something, but it was definitely affecting. You can have an occlusion because the facial artery, runs all the way down.
So filler toward the eye.
It had to have. And so to have permanent damage, she's about to fall asleep.
Oh, baby. Oh, baby.
You got to get that reversed. And this was someone that was doing it out of the house. So you can go to the ER too, but the ER is not going to know. They're not going to have the drug on hand to reverse it. They're going to do everything they can to, help you out. But you need an injector that knows what they're doing and one that you can go back to and say, hey, this is going on. And an occlusion can look like a bruise initially.
Yeah.
It can totally look like a bruise. So.
You know what I think that we should implement or something? Like whenever you go and get a breast implant, they'll give you like a card. It says what type of implant you have, how much, how many cc's and stuff. Like people need that same thing for filler and Botox, so that we can know, like, if you go to somebody and you didn't get a good or even if you went to somebody in the past and you had a great experience and it was good, but you're coming back, you want more. Like, it's still helpful for us to know what kind of filler you already have in there. So I think we should keep little like cards, like an immunization record or something. Each time you get a filler, this is the filler, this is the date.
Yeah.
So we can keep track. And
people hop around.
And then we know how to dissolve it too, because there's some fillers that can be dissolved and some that can't.
Yeah. So keep that in mind when you get filler. And if your injector can't tell you what it is, or, can it be reversed, that's a problem. So there's several things, and I've talked about it in a TikTok video that which we'll get to in a minute, you need to ask the person that's about to do this procedure on you. But with filler, technique matters, and technique improves over time the more that injector has experience with the filler. And it does need to be a medical professional. At least in the state of Texas, it has to be a medical professional. And it can't be a medical assistant. And It's not supposed to be a licensed vocational nurse either, but if the physician is there or the supervisor who is supervising them is there to react or also to help in the building, then possibly. But there's no delegation orders anymore. You can't just write things and say, I give them permission, this eyelash girl permission to do filler when I'm not here. No, it's illegal. There's just not anybody governing it. It's kind of a gray area. Like, does the Texas Department of License and Registration deal with it? Does the health department or does the medical board of nursing deal with it? So there's no one coming after these facilities and pretty much surveying them to see who's in here, who has certifications, and where's your physician.
Right.
Yeah. Because, you can go on and buy filler online from other countries.
Yeah.
You should, but like technique definitely matters, and less is more a lot of the time. So I don't know about you, but I would feel people and they're like, I don't know, should I do more? I'm like, if you're not sure, wait 2 weeks. A lot can change and settle in 2 weeks. We can always add in. We can always reverse, but I can't control how much reversal.
And that's a waste of your money, too.
It's a waste.
Because we'll still have to charge you. It's not like you pay for a syringe and then we have to reverse that syringe that you get another one, the next one for free. Like, you still have to pay for that other syringe. So it's a waste of your money. But also there's a lot of swelling and stuff that happens while we're doing it. So let's wait the 2 weeks, see how much is actually filler, see how much is swelling, and then we can adjust from there.
Right. Yeah. Little at a time. And a little, like I said, can go a long way. What was the other thing I was going to say about that? 2 weeks.
Oh, if they want more filler?
They want more filler too. Oh, ways to prevent bruising or minimize it.
Oh, yeah.
So, if you're taking vitamin E, turmeric, omega-3 fish oil, those things thin your blood, wine, alcohol, of course, that, aspirin, ibuprofen. So that your risk of having bruising is a lot more likely if you're, using those things. So you have to stop them a little bit before. And it's not about your injector, as far as how good they are, whether or not you will bruise. It's just
your anatomy.
Yeah, it's your anatomy. We're sticking a needle on
the vitamin E oil or the vitamin E. Just to clarify, like, vitamin E is in most multivitamins too. It's it can also be in people's like protein powders or people taking other kind of supplements. So you're just going to have to look at your ingredient list and see if there's vitamin E in it and maybe hold that for a week if you can, but
that'd be nice. Yeah.
But it's not anything major. So at least 72 hours is probably appropriate.
Before, and then I would hold it by after, because then you're going to thin the blood and you've got healing tissue and things that are not, clotted or whatever. So I've seen people do that where they went binge drink. They weren't bruised when I seen them, but the next time I seen them, they were black and blue, but they went out and partied that night and drank a whole bunch, so then thinned their blood, and now we've got bruising. So it's not about the injector. Sometimes it is, but for the most part, it's about your anatomy, and we're sticking a needle in your face. So
I think age plays a role too, because as we age, our blood vessels get thin, and like the thinner, more fragile the lining of our blood vessels is, the easier it is for them to rupture.
Right.
And so
it's more noticeable because our skin is thinner too.
Yes. And so age plays a role in it as well.
Some things you can do to kind of help prevent it or minimize it would be Arnica montana. That's a supplement that helps promote healing. It's like a homeopathic medication. You can buy it as a gel, or you can buy it as capsules you take by mouth from a health food store. Amazon has them. And then pineapple, fresh pineapple.
Oh, yeah.
It has the enzyme in it to help break down is it hemosiderin in the actual bruise. So it helps with healing and breaking the bruise down. So just eating fresh pineapple after would be beneficial. So, and does it hurt?
Yeah.
Yeah.
Sometimes.
Yeah, sometimes. Yeah. It depends on do you get a dental block, or is the cream really good that your provider's using? So when they ask me, I'm like, it is a needle going in your face. Like, I don't know what you're telling me.
Okay, so here's another controversy I see when people get filler or Botox and then they get handed a little ice pack.
Mm-hmm.
Like, yes or no on ice packs?
Yeah, I mean, you could. A lot of the times I do send my patients with them just because it helps minimize swelling directly after. It doesn't get any worse.
Mm-hmm.
And then it's kind of like a customer service thing too.
Mm-hmm. Would you put it on your Botox though? Or do you feel like that would lessen the spread? Yeah.
Yeah, I wouldn't put it on your Botox.
Because you want the Botox to spread a little bit.
Right.
And if you freeze the Botox,
is it going to go?
Then it might not spread to the area that it needs to for you to get the full results.
Mm-hmm. And I've never had, well, I've had filler in my face, but I have had a reaction one time ever, and my lips blew up. They were huge. I have to find the picture. Huge. I show people that because it's so funny. But they were small, and then as the day went on, they doubled and tripled in size. And then that night, I could barely talk. So I ended up calling the PA I worked with. I'm like, we've got to meet at the clinic because this is bad. Bad. And I'd had this filler before. It's just my body decided to react. So we had to do a round of steroid. I can't remember what else we did. I was like, this got to go down by tomorrow. But it just never happened again. Never happened again. But that one time it did, and it got out of control. It was huge. Like you wouldn't have recognized me. They were so big. So big. I have to find those pictures and show you this.
So that reminds me. So whenever they went to reverse my occlusion, and they put the, however you say it, hydrogenolase. How do you say it?
Hylenex is the
Hylenex. Yeah. Whenever they put that in there, I know that some people like swell up really bad with the Hylenex, and I was afraid. I was asking questions before. I was like, "Am I going to swell up really big?" And I'm like, "No." Some people have like an allergic reaction and might have like an anaphylactic reaction where they have that bad angioedema or whatever. Okay, so she put it in. I immediately could feel some swelling, and she grabbed it and she said, "You would be the one to respond like this." Immediately, my heart stopped. I was like, "Find my phone." I was like, "Here's my phone. My passcode is this. Call my husband. We're 4 hours away." They're like, "What?" I said, "Anybody have an EpiPen?" Like, I was trying to figure out how to save myself. She was like, "No, like, you're just having like a little bit of swelling." But in my mind, I was like, "I'm dying."
Yeah, that's another thing. When you're injecting someone's face, you don't say oops or
you would respond like, I was like, "That's it." But then like, but that also goes back to like, even not having a medical professional, you know, like, so if I was having an anaphylactic reaction and I was with somebody that's not a nurse or doesn't know emergency medicine, and I started having an anaphylactic reaction, then what?
Everybody's going to close before they figure it out. Scary stuff, guys.
And I'm not dogging on anybody because like I do know a couple of people that aren't nurse injectors, but I know they're smart ladies and like they run a good business and they're professional and they do extra studies on it. And so again, we're not dogging people that have certification and that's done the training and stuff, but we're just saying be cautious.
Yeah. There's a limit. There's definitely a limit. And Texas would not have made it the way it is if there hadn't been several incidents of unlicensed people. So just be careful. Filler that looks bad. So filler has this stigma, like, I don't want to look overfilled. Well, I'm not in the business of making you look crazy because my name is on your face.
Yeah.
And so people are going to ask who did that, and you're going to tell them. And so I would like we were talking about, do a little, wait, add some more. But there are people, and I've had them come in and see me, and their lips are huge, and it's time to top them off. And they've been going to this plastic surgeon in Dallas, and he's been filling them up. She's probably got 3 or 4 syringes in there, and that's the way they want it. And I'm like, I'm not your girl for that. I don't care how much money you throw at me because people are going to notice you when you walk in the room. They're going to be like, where'd you go?
Well, and aside from that, it's the same thing. It becomes unsafe. The more filler, the more migration, the higher the risk of occlusion.
Right. It's a lot of pressure in there. Like you're filling a small space. So, or you'll see people that have like, they'll have a crease right here above their lip because their lips are so big, they're folding back on themselves. So they'll have a crease here, or they'll look, you'll have to look at them without makeup, but you'll see the filler has then started coming out. And I've had that in my lower lips where it just migrates over time.
Yeah.
Like, especially if you put too much in a small area, it's got to go somewhere. And so it'll go outside, and then you get these inner tube looking lips. And so migration happens, overfilling happens, wrong product happens, it's too superficial. There's someone that I'm actually working on right now. We've been reversing hers because an experienced injector in a nearby town, who's phenomenal, they say, let her leave with superficial blebs in her lip. And so now I'm having to reverse them. And what's weird is they weren't huge, but they're taking a lot to reverse. So I'm like, is it HA? I don't know. I don't know what it was. So now we're having to dissolve and start over. So money's wasted. And then this person, the patient told her, like, before they left, hey, is this normal? Like, should we be seeing this? And sometimes it's hard to tell because, you just
there is some swelling.
There's trauma. Yeah. But you could see it was like grayish little blebs in where they had injected too superficially.
And so if you continue to try to dissolve and it doesn't dissolve, then those little granulomas, they have to be cut out.
Oh yeah. You can cut. Actually, this patient, I was able to puncture it with a needle and squeeze it out.
Mm-hmm. Yeah. So that's why we're saying you need to know what kind of filler you're getting, because there's some filler that can be dissolved and there's some filler that has to be extracted, like
right. Yeah.
taken out.
Then you're dealing with scars.
Which is painful and scar tissue. And
yeah. And then I think there's a good place for filler and Botox right now just because we're dealing with all the GLP-1 craze. And people are losing large amounts of fat in their face. And their face just, they lose volume. They don't look like the same people. And so some people's skin doesn't bounce back. And then as you get closer to menopause, your estrogen drops. That's what keeps our skin so like plush and elasticy, and we lose that with time. And so we don't, losing estrogen just kind of topples on top of that. Like, it's a lose-lose unless you're doing some kind of maintenance over time, or losing the weight slower rather than rapidly so your skin can react.
And what about being like reasonable? Like, you can put some cheek filler in, but you don't want to be looking crazy with big old rolled up socks looking on your face. I don't know. So what do you feel like is a reasonable amount of filler, which I guess everybody's face would be different. I was going to try to help people out and say, like, if you're going to require more than 1 syringe, 2 syringe of filler, you probably would be better off getting a consultation for a facelift.
Right. Yeah. And there's some patients that I've told that, like, you have way too much elasticity. Like, we're going to be filling a balloon with so much filler and you're not going to look natural. You need some things put back in place. And so, pick a lot of the reps that come out and like sell you these products say, okay, you need 1 syringe here, 1 here, 1 here. And if you do jawline, you need another one and another one. They're trying to sell to you. They're trying to sell to the, person, but you got to know your limit. And I do have patients come in and say, I want my lips done, my cheeks done, and I want half a syringe.
That's not reasonable.
Good luck. Yeah.
You won't notice a difference.
No. And if budget is a problem and you can't get the full result, wait until you can get the full treatment.
Or let's do your lips today. And then whenever you have money,
just save up
for the cheeks, come in, we'll do your cheeks after. Or whichever, vice versa, whichever you prefer. Like, if the cheeks bother you more, let's do the cheeks today.
Right.
And then come back a later time and we'll do the lips.
Yeah. Oh, yeah. I really don't like splitting syringes either. And the reason for that is once you open it, then there's opportunity for bacteria to get in the syringe. When am I going to use the other half of it? Even though I put the same sterile stuff back on that little syringe, I still have a half that's sitting in a cabinet for however long until someone buys it. Well, then I lose money And I put the patient at risk because I've done pre-split it. Someone else bought the other half. So I really don't like doing that, and I charge more if I have to. I really advise if you're going to get a half, find a friend that maybe wants the other half.
Yeah.
So
And y'all come in together.
It works out because fillers not cheap. Fillers are cheap. So Botox, fillers, skincare, what should you do? You could do it all. I mean, you just need to know who's doing it. And I guess that's what we could end with and talk about is making sure that when you go into somebody, you ask where their training was. Where'd you get your medical certification or license from? Who's your medical director? How long have you been doing this? Things like that. And if they can't answer them, that's a red flag. That is a red flag. What do you have here in case something goes wrong with the filler? Do you have something you could do that, just asking them the questions that should be answered and that a medical professional could answer? And a lot of the times they won't be able to answer them.
Yeah.
No. And you can go to a 2-day certification course. I could be certified plumber.
You don't want me fixing your pipes.
You don't want me fixing those pipes. No, you don't. But anybody could just go, and I say plumber, I'm sure it requires a license, but I'm saying just a certification for anything. I can print a certification for anybody and hang it up on the wall. What's a 2-day course or a 1-day course?
Yeah.
That does not make that eyelash girl or that esthetician, knowledgeable enough to safely put these things in your face. So they're thinking about this, and they're not thinking about the risks that they're putting, on you and on them by doing it. So
I have 2 other comments too.
Okay.
When we were talking about other things for Botox, it shrinks your pores. So people with large pores, a lot of times if they get Botox, then that helps shrink those pores. So that's another Botox use. And then the other thing is cheaper is not better.
Yeah.
Yeah. So when you're getting priced, and more expensive is not better either.
Right.
So whenever you're shopping around and you're asking prices, you need to ask, you need to be comparing product to product. Because if I say, oh, well, I'm selling you Botox $14 a unit, and such is selling for $9 a unit, is the $9 a unit, is that the Dysport where it's more high risk for spreading?
Is it diluted?
The $14 a unit, is that the whatever the new one is you talked about? I just forgot the name.
Lativo.
So comparing product to product and then comparing experience. Those are the 2 things that I would.
Yeah. You're paying for, at least the way I look at it now, I've been doing it for 12, 13 years. You're paying for my experience. You're not paying for that product. That product can't give you what I can give you. You're paying for experience, for someone that's been doing it long enough and can catch things or is creating a certain type of look. That's what you're paying for. Don't think about, oh, that filler's cheaper, I'm going to go to her. You're going to get some cheap filler, and you're going to get what you paid for, if not more.
Some black market filler. It's cement.
Yeah, and then you'll come to me and ask me to fix it. So you just, you need to know who's doing it. And in the state of Texas, it cannot be anyone unlicensed. It needs to be a registered nurse, nurse practitioner, physician assistant, or medical or physician.
Yeah.
Those 3. Well, 4. It needs to be those things, not anybody else. So
and write down what product.
Yeah, remember what you got.
Like you keep a med list, like you keep an immunization record. It's just to help you, and I get confused on the names of the products. There's so many. Yeah. Obviously, I just forgot them a minute ago. But so write down the name of the product that you're getting injected.
There are so many people that don't know. I'll ask them, what'd you get last time? I don't know. What? I would not let someone put Tox in my face unless I seen what they put in my face or the filler. And you need to see, is it fresh? Because if it's not a fresh bottle of filler, of Botox, you're not going to get the same effect. How long's that bottle been sitting in their fridge? 2 weeks ago since they had the last client? You're not paying for the right product. And then you need to, a lot of the times I bring it into the room and I open it and reconstitute it in front of the patient.
That's what I like. I like to see because we all know that I'm a little bit paranoid, right? And
things can happen.
But I'm Is there actually Botox in that bottle, or did you just fill it full of saline and you're charging me for Botox? So you're making 100% profit. Like, so there's a lot of questions to ask.
Oh yeah, definitely. And and one thing with the Botox is if your eyelid is dropped, it could be dropped for 3 to 4 months. There are eye drops and stuff that can help try to open it, but if somebody didn't know what they were doing and dropped an eyelid like you're like that for a while, you're going to be stuck down.
Yeah.
So I have seen that. That has happened once in my career, and it's because the patient and this patient was a nurse, after I done told this patient, don't go to the gym, don't go lay face down, don't massage your face, don't go take a nap flat,
don't go tan.
She went and got a massage. So she put her face in the donut the same day that I put Tox. And I've talked to this person before, so it hadn't happened. But I felt awful when she messaged, and she was so sweet about it. What's happened? Like in her little eyes like this, like hanging down over her pupil so she couldn't see.
Oh my gosh.
Oh, and then she tells me, well, I did go get a massage right after. I'm like, oh my God, did you put your face in that thing? And she did.
And so what happens with that is the product moves, like, and it'll move to, so the Botox, when you inject it in, it doesn't stay right in that area like we've talked about. It's got to spread. And if you're face down, it's spreading somewhere opposite of where we want it to spread to.
Right. That's why you need to know anatomy. That's why you need to know anatomy. For sure. Anything else we want to talk about with that?
No. I just want more Botox and filler.
I know. I think about it. I do talk to myself, and I have done filler on myself, but I haven't done filler in my lips. It's been 5 years, 6 years. It's a long time. And I didn't have no lip. No.
Just to be transparent, I'm fully aware that I'm a hypocrite, right? That I'm going to talk about microplastics and then I'm going to get filler injected. So it's all about balance. Okay?
Right.
Yeah.
Yep. And time and studies. There's a lot of people living with filler and Botox in their face.
Right. I don't want the vaccine, but I want the GLP-1. So I'm definitely, when I say I'm non-biased, I'm middle of the road.
She really is.
Yeah. But I guess that's what they call the crunchy moms, right?
Somebody said that to me yesterday. She's like, I think I'm crunchy. And she's like, that's the word because we're trying to get rid of plastics. I'm like, crunchy.
I need to look more into that before I label it myself.
What is crunchy?
I don't know. Look it up and it says some other weird stuff. And here I am telling people I'm crunchy.
Crunchy. Yeah. When the patient said that to me yesterday, I'm like, I don't know.
I'll have to look it up.
What crunchy is. But yes, so if you have any questions or anything, me and Jessica had a fair share of it in our own face and body that we could probably answer and kind of direct you. And I can just spot a fake a mile away. And I don't know what it is, but I should have been an FBI agent, I think. Because I can tell just based on certain things they post, certain things they do, and their habits, if they're truly a medical professional. So, I mean, if you wanted to know if that girl down the street is legit, I can look at it for you. I may not be 100% sure, but I can tell you, based off of speculation, this is what you need to ask and see if she can produce it. If she can't, you need to go find somebody else. Even though she's cheaper, that does not mean anything. So, all right, guys.
Until next time.
Y'all take care.